البكتيريا اللي هو جنس Mycobacterium. This bacteria is slow growth and acid fast bacteria. This bacteria, when stained with the Nielsen stain or called acid fast stain, retain the basic dye carbolfoxine, which has a red or pink color, and this stain is not removed by using acid alcohol, and the background of slide become blue due to staining with counterstain methylene blue, while the bacteria remain red or pink. One of the most important feature or distinct feature of this bacteria is to contain the mycolic acid. Only bacteria that have mycolic acid is a mycobacteria, and sometimes this is in the members of genus Nocardia. A virulence factor of this bacteria is complex lipid-rich cell wall. The virulence factor of this bacteria is the cell wall. This cell wall is thick and help bacteria to resist to different types of chemicals. This virulence factor or cell wall responsible for many characteristics of this bacteria, including acid fastness, low growth, resistant to detergent, resistant to common antibacterial agent, and antigenicity. So require for the special treatment for treating the disease. There are first line drug for TB and second line drugs for treatment of this infection. Infection acquired through the inhalation of aerosolized infectious particles, which then travel to the terminal airways. At the site of entry, the bacteria penetrate into the activated alveolar macrophage, phagocytosed, and prevent fusion of phagosome and lysosome. Then replicate freely inside the macrophage. One of the most important mechanisms in the defense, on the host defense against microbes, is phagocytosis by antigen presenting cell or neutrophil. Macrophage or alveolar macrophage, one of the most important defense mechanism inside the lung or respiratory tract. This bacteria, this cells, macrophage, when unactivated, can be infected with different type of microorganisms, especially Mycobacterium tuberculosis, and prevent their action by prevention phagosome lysosome fusion. يعني شباب انه احنا unactivated macrophage، يعني الماكروفاج اللي هي غير فعالة راح تكون عرضة إلى دخول أنواع مختلفة من الميكروبات، وخصوصا مايكوبكتيريوم تيوبركلوسيس. وبالتالي فلما تتم عملية الفاجوسايتوسيس من قبل هذه الماكروفاج ما راح تحتوي على المواد الخاصة بتحطيم هذه البكتيريا، والبكتيريا نفسها تمنع عملية الفيوجن between phagosome and lysosome. So this bacteria remain freely inside the macrophage and replicate. Organism then elicits cell-mediated immune response, is a key type of immune response that help in controlling of infection. The intracellular replication of microbacteria stimulate both types of helper cells, CD4 plus and cytotoxic CD8 plus T cells to form granuloma. يعني هنا راح يكون عندنا humoral and cell-mediated immunity, but the control of infection is occur due to the activity of cell-mediated immune response. This figure shows the effect and cytokine production during the infection with TB. An activated macrophage can be, activated macrophage when activated by using gamma interferon that are produced from different type of cells, such as T helper 1, CD4, or dendritic cells, help in the activation of macrophage and destruction of microorganism or bacteria by cytolysis. Mycobacterium tuberculosis is virulence factor organism able to replicate in non-activated macrophage, can survive for 4 years in dormant state، يعني راح تبقى موجودة في داخل أنسجة الرئة للمضيف in a dormant state inside the granuloma. Pathology depends on host response to infection rather than produced by bacterial toxins or enzyme. This bacteria no toxin producer. هذه البكتيريا ما راح تنتج توكسينات، وإنما the effect or pathology is depend on immune response state. Disease can come on suddenly with patients having non-specific complaint of malaise, weight loss, cough, and night sweating. Constituent of tubercle bacilli, mycobacterial cell contains only said delay hypersensitivity reactions in a previously sensitized animal. The constituent of this bacteria, including lipids, mycobacteria are rich in lipid, including mycolic acids, waxes, and phosphatides. In the cell, lipids are largely bound to protein and polysaccharide. Soluble are some extent responsible for acid fastness. مثل ما حكينا بالمختبر العملي قلنا انه Nielsen stain or acid fast stain depending on the presence of high amount of lipids in the cell wall of mycobacteria. Proteins, each type of mycobacteria contains several types of proteins that elicit tuberculin reaction. Tuberculin reaction is the injection of individual by purified protein derivatives, types of protein subcutaneously, which help in diagnosis of this infection by appearance of rash and redness, fever inside the site of injection after 48 hours. يعني هنا التوبركلين تيست راح ناخذ البيوريفايد بروتين ديريفيتيف الماخوذ من المايكوبكتيريوم ويتم حقنه تحت الجلد، والنتيجه نلاحظها بعد 48 ساعه. ليش نلاحظها بعد 48 ساعه؟ لانه نوع التحسس هنا عندنا هو اللي هو التايب 4 delayed type of hypersensitivity reaction related to cell mediated immune response, while the sensitivity or allergy against due to penicillin belong to the type 1 hypersensitivity، بحيث انه الحساسيه للبنسلين راح نشوفها بعد مرور 15 دقيقه الى 30 دقيقه، بينما هنا لا تحتاج الى 48 ساعه. Also, polysaccharide is a presence, a variety of polysaccharide is a presence in the cell wall of this bacteria. Their role in the pathogenesis of disease is uncertain and can be induced, maybe induced the immediate type of hypersensitivity and can serve as antigen in reaction with sera of infected person. Now we study Mycobacterium leprae. Mycobacterium leprae is responsible for leprosy, also called Hansen's disease. Endemic disease found in armadillos, spread by person-to-person contact, by inhalation of infectious aerosols, or direct contact with lesions. The clinical manifestation depends on patient's immune reaction to bacilli. There are two important types of this disease, tuberculosis leprosy and leprosy leprosy. طبعا من الضروري جدا شباب انه تفرقون بين النوعين. هذه النوعين يعتمدون يعني او ظهور اعراضهم تعتمد على الاميون ستيت اوف patient. In tuberculosis leprosy, we see low infectivity, strong cellular immunity, but weakly humoral antibody response. Infected tissue typically have many lymphocytes and granuloma, but relatively few bacilli, so become low infectivity. يعني الشخص المصاب بالتيوبركلوز ليبراسي ايش راح نلاحظ عنده؟ انه low infective, strong cell-mediated immune response, weak humoral immune response. Tissue or infected tissue have many lymphocytes and granuloma and few number of bacilli. While in the leprosy leprosy, most infectious form, highly contagious, strong antibody response, but specific defect in their cellular response, and abundance of bacilli are typically observed in dermal macrophage and Schwann cells of peripheral nerve. يعني هنا راح يصير فروقات بين التيوبركلوز والليبريماتوس. تيوبركلوز low infectivity، هنا high infectivity. هناك high cellular immune response with weak humoral immune response or humoral antibody, while in leprosy strong antibody response and low cell-mediated immune response. High or low number of bacilli can be seen in tuberculosis leprosy with high number of lymphocytes, and vice versa can be seen in leprosy. Mycobacterium avium complex has many species of mycobacteria, but most important is Mycobacterium avium and Mycobacterium intracellulare. In fact, the gut found in AIDS patients acquired through the ingestion of contaminated food or water. شباب اكو سؤال لحد الان؟ شباب
واضحة إن شاء الله دكتور.
ان شاء الله واضح. اشكرك. احنا اهم شيء عندنا تفرقون بين الليبروماتوس والتيوبركلويد ليبراسي. Lab diagnosis of mycobacteria by skin taste مثل ما تحدثنا قبل قليل. Use purified protein derivative of cell wall and inject subcutaneously, and the result seen after or through the 48 hours. If person was exposed, it will swell and have redness and fever at the site of injection. After positive test, use chest X-ray to lock lesion. Chest X-ray is very important in diagnosis Mycobacterium tuberculosis. Acid-fast stained bacilli also used, stained with carbolfoxine and dechlorized with acid alcohol, then stained with counter stain, which called methylene blue. Now, culture. The media for primary culture of this bacteria should include non-selective media and a selective media. Selective media contain antibiotic to prevent the growth of other bacteria and fungi, and there are three formulations of this media. The first is semi-synthetic agar media. This media including Middlebrook 7H10 and 7H11, which contain salts, vitamin, cofactors, oleic acid, albumin, catalase, glycerol, glucose, and malachite green. ليش يعني نلاحظ انه هذه الوسط يحتوي على كميات كبيره من الليبيد، لانه البكتيريا تحتاج الى الليبيد لغرض النمو وتكوين السيل وول. The 7H11 medium contain casein hydrolysate. Also, this media may be less sensitive than other media for primary isolation of mycobacteria. The semi-synthetic agar media are used for observing colony morphology, for performing susceptibility test to antibiotic, with added of antibiotics as a selective media. And spissated egg media. This media is Lec.11 media, widely used in our laboratories, containing defined salt, glycerol, and complex organic substances such as fresh eggs, egg yolk, potato flour, and others. Malachite green is included to inhibit the growth of other bacteria. لذلك يكون لون الوسط أخضر هنا بهذه الحالة. Small anicula and specimen from patient will grow on this media in 3 to 6 weeks. This media with added antibiotics are used as a selective media. طبعا نلاحظ انه فترة نمو البكتيريا او حضانتها او ظهور المستعمرات تكون طويلة من 3 إلى 6 أسابيع because of this bacteria is slow growing. The generation time or doubling time of this bacteria is 13 hours when compared with other bacteria or fast growing bacteria such as E. coli, which has a doubling time to 20 minutes. Both media, including Middlebrook 7H9 and Middlebrook 7H12, support the proliferation of small inicula. يعني إذا مثلا البيشنت يحتوي السبيوتم يحتوي على أعداد قليلة من البكتيريا واللي ممكن ملاحظتها باستخدام الزيل نونسون ستين، هنا بهذه الحالة احنا راح نستخدم البروث ميديا for supporting the proliferation of this inicula, and the growth is often more rapid than on complex media. Mycobacteria tend to be more resistant to chemical agent than other bacteria because of hydrophobic nature of the cell surface. Again, the hydrophobic nature of the cell wall of this bacteria is due to presence of high amount of lipid. And their clump factor. Dyes malachite green can be incorporated into media without inhibiting the growth of tubercle bacilli, but able to inhibit other types of bacteria. Acids and alkenes permit the survival of some exposed tubercle bacilli. So tubercle bacilli are resistant to drying and survive for long periods in dry sputum. Also, this bacteria can be diagnosed by using molecular techniques such as polymerase chain reaction. شباب الدايجنوزز واضح؟ شباب
إن شاء الله.
إن شاء الله. Now, pathology of this disease, the production and development of lesion and their healing or progression are determined chiefly by number of mycobacteria in the inoculum and their subsequent multiplication, and the resistant hypersensitivity of the host. This infection depends mainly on the immune state of individual. When immune state is strong, especially cell-mediated immune response, this leads to control of infection and vice versa. Two principal lesions can be seen during TB infection. The first lesion called exudate type. This consists of acute inflammatory reaction with edema fluid, polymorphonuclear leukocyte, this means neutrophil, and later monocyte around the tubercle bacilli. This type is seen particularly in lung tissue, where it resembles to bacterial pneumonia. يعني بالبداية راح نشوف إنه راح تتجمع البوليمورفونيوكلير ليكوسايت والمونوسايت around the bacilli or tubercle bacilli with the presence of an acute inflammatory reaction and edema. Productive type, when fully developed, this lesion, a chronic granuloma, consists of 3 zones. The first zone is central area of large multinucleated giant cells containing tubercle bacilli. This multinucleated giant cells composed from the fusion of many or several epithelial cells present inside the lung. So this cell or multinucleated giant cells has a number of nucleus. Mid-zone of bell epithelioid cells with often arranged radially, and peripheral zone is composed from fibroblast, lymphocyte, and monocyte or tissue macrophage. Later peripheral fibrous tissue develops, and the central area undergoes caseation, necrosis. Such lesion is called tubercle. This lesion can be seen by using chest X-ray. This case or caseation occur when down-regulation of cell-mediated immune response is occur. يعني إذا تبقى عندنا cell-mediated immune response intact, caseation ما راح يحدث لأنه راح يكون هناك control of infection وتبقى الإصابة. بس لما تتغير الحالة المناعية للمريض ويصير عندنا shifting from cell-mediated immune response to humoral immune response، يعني اللي هي antibody immune response، راح نلاحظ انه تحدث عندنا عمليه الكازيشن and necrosis and can be seen by using chest X-ray. Treatment: chemoprophylaxis can be used for 9 months, isoniazid for 9 months, 4 months of rifampicin, and 2 months of pyrazinamide. This drug, your isoniazid, rifampicin, ethambutol, pyrazinamide, is called first generation or first line drugs for treatment of TB. Second line including ciprofloxacin, streptomycin, and others. Epidemiology of TB: the most frequent source of infection is human, who excrete large number of tubercle bacilli. Close contact, especially in the family, and massive exposure, such as in medical personnel, make transmission by droplet nuclei most likely. Susceptibility to tuberculosis is a function of the risk of acquiring the infection and the risk of clinical disease after infection has occurred. For the tuberculin negative person, the risk acquiring tubercle bacilli depends on exposure to the source of infection, presence of bacilli, number of bacilli, especially sputum positive patients. This risk is proportionate to the rate of active infection in the population, crowding, socioeconomic state, and an adequate of medical care. All these factors or risk factor represent a determinant for the development or spreading of mycobacterial infection. Now, also treatment should be prompt and effective treatment of patients with active tuberculosis and carefully follow up of their contacts with the tuberculin test and X-ray. Drug treatment of asymptomatic tuberculin positive person in the age group must prone to develop complications, especially children. Individual host-resistant non-specific factors may reduce host resistance, thus favoring the conversion of asymptomatic infection into disease. يعني احنا قد يكون الشخص carrier or asymptomatic، ولما نقوم بإعطاء أنواع من التريتمنتس أو drugs or some types of vaccine. This lead to shifting from cell-mediated immune response to humoral immune response. This lead to progression of infection. Immunization various living virulent tubercle bacilli, particularly BCG, Bacillus calmette-guerin, used for controlling of infection, and 5, the eradication of tuberculosis in cattle and the pasteurization of milk have greatly reduced mycobacterial bolus infection. Now, Mycobacterium leprae, the onset of leprosy is insidious. The lesion involves the collar tissue of the body, such as skin, superficial nerve, nose, pharynx, larynx, eyes, and testicle. Now, why this region is favorable for this bacteria? Because of the favorable temperature for growing of this bacteria is 31 degree. يعني هذه البكتيريا تفضل النمو في درجة حرارة 31 درجة مئوية أكثر من 37 درجة. لذلك تكون مواقع الإصابة site of infection is a collar tissue such as special skin and nose. Skin lesion may occur as pale anesthetic macular lesion 1 to 10 centimeters in diameter, diffuse or discrete erythematous infiltrated nodules 1 to 5 centimeters in diameter, or a diffuse skin infiltration. Neurologic disturbances are manifested by nerve infiltration and thickening with resultant anesthesia, neuritis, paresthesia, tropic ulcers, and bone resorption and shortening of the head. The disfigurement due to skin infiltration and nerve involvement in untreated cases may be extreme. Disease is divided into two major types، وهذا تكلمنا عنه قبل قليل. قلنا عندنا الليبريماتوس اللي هو الهايلي انفكتيف فورم، و tuberculosis leprosy اللي هو low infected form. And the leprematous course of progression and malignant with nodular skin lesion, slow symmetric nerve involvement, abundant acid-fast bacilli in the skin lesion, continuous bacteremia presence, and negative lepromine taste. Extract of tuberculin taste خاص بالمايكوبكتيريوم tuberculosis، وهنا عندنا الليبرومين تيست اللي خاص بالمايكوبكتيريوم leprae. Also skin taste and resemble to the tuberculin taste. And leprematous leprosy is cell-mediated immune response is markedly divergent, and the skin is infiltrated with suppressor T cells. While in tuberculosis type, course is benign, non-progressive, with macular skin lesion, severe asymptomatic nerve involvement of sudden with few bacilli present in the lesion, and a positive remain skin taste. Any tuberculosis leprosy cell-mediated immunity is intact, and the skin is infiltrated with helper T cell. شباب اكو سؤال جدا مهم انه تميزون بين الليبريماتوس او تلاحظون الفروقات اللي هي بين الليبريماتوس and tuberculosis leprosy. شباب واضح؟ مهم ماشي. ضروري جدا انه تميزون بين هاي النوعين من المرض. Now, for diagnosis, scrubbing with the scalp blade from skin or nasal mucosa or from a biopsy of ear lobe skin are smeared on slide and stained with Nielsen technique. Biopsy of skin or of a thickening nerve give a typical histologic picture. No serologic tests are of value. Non-tribonimal serological tests for syphilis frequently yield positive result in leprosy. False positive result in leprosy. Also, we can be used molecular technique, PCR or DNA hybridization for detection of this bacteria. Treatment using cell phones such as dapsons are first-line therapy for both tuberculosis and epidermolysis leprosy. Rifampicin and clofazimine generally is included in the initial treatment regimen. طبعا دائما يكون معالجة الميكوبكتيريال infection either Mycobacterium tuberculosis or Mycobacterium leprae infection has a combination of several drugs. أكثر من أنتيبيوتيك يجب استخدامه في هذه الحالة للعلاج بسبب إنه هذه البكتيريا developed antibiotic resistance rapidly. Other drugs active against Mycobacterium leprae including minocycline, clarithromycin, and some fluoroquinolones such as lefloxacin and ciprofloxacin. Epidemiology, transmission of leprosy is most likely to occur when small children are exposed for prolonged periods to heavy shedders of bacilli. Nasal secretion are the most likely infectious material for family contact. Incubation period is probably 2 to 10 years. Without prophylaxis, about 10% of exposed children may acquire the disease.
دكتور الصوت قطع.
ماشي. شباب هسه جاي يسمعون؟
نعم دكتور.
موجود؟ ماشي. عندنا الابديميولوجي. Epidemiology in Italy, the transmission of leprosy is most likely occur when small children exposed for prolonged periods to heavy shader of bacilli. خصوصا الأطفال بتعرضهم المستمر للشخص الحامل للإصابة أو المصاب راح ممكن يصير gynec for infection. Nasal secretion, most likely infectious material for family contact. Incubation periods هنا نلاحظ انه long incubation periods from 2 into 10 years. Without prophylaxis, 10% of children may exposed children may acquire the disease. شباب اكو سؤال يخص المحاضرة؟ آمنة إبراهيم؟ آمنة اكو سؤال؟ آيات واضحة المحاضرة ان شاء الله؟
ان شاء الله.
ماشي. المحاضرة دزينا لكم اياها على التليجرام. زين؟ الوورد والباوربوينت. ماشي شباب اكو سؤال؟